was just a regular day. I had made a number of farm calls. So I thought, well, I'm really close to Culver's. I think I'll go to their restaurant and grab a hamburger. So I did that, was there sitting in a booth eating the hamburger when I got the sudden pain kind of across my belt line, low in my back. And within a minute or two, I was starting to feel a little lightheaded, thought I might pass out, and I began to perspire pretty severely. And I said, man, this is serious pain here. I've got something kind of wrong. So I realized that my wife should be home by that time of day, and she being a nurse, I thought I would seek her counsel.
He came in the door and he was in severe pain, and he just sort of laid down on the floor. And the pain was not letting up, and it was severe, so I said, let's get in the car, we're going to the emergency room. And I called the hospital and told them we were on our way in. And Dr. Bosick was there and decided to do a scan. I had stepped out down the hall no more than 10 minutes. And when I came back, I had said, he's got an aortic aneurysm. It's 8 centimeters. And they told me they had called mid-flight, or were calling it. They had him prepped for surgery.
I remember being loaded on a helicopter because I could smell it. I was in enough pain that I wasn't holding still very well, rolling around and groaning, and they were wanting to get me to hold still because they were fearful that it would rupture on the way and I would arrive already gone. I don't know who, but someone bent down. I recall them getting very close to my face, and he said, you're just going to have to hang in there another 10 minutes because we're flying this as fast as we can go.
They took him through emergency room straight to the surgery room, and it ruptured when they put him on the surgery table.
The fact that they called right away from med-flight because they realized this was going to require a special surgeon. The fact that they had me prepped is the thing that made the difference.
Without the Richland Hospital here, the quickness of the treatment and the ability of people to survive, it's something they can survive, that there is any hope for, would be gone. That's just what saved his life.
It was just a really freak thing. I had a motorcycle I was working on that was running a little too rich in the woods. It was an off-road bike, and I was just about done, and it was running really well. And I was coming out of a corner and lofted the front end a little bit, and when I did that, the throttle stuck right at about 3/4 throttle. And so it just slammed me right into the ground backwards, and I hit and started rolling, and I knew before I was done rolling that something wasn't right. I looked down at my legs, and they were just disfigured. Both of them were offset, and I had to pound on my lower leg to get that to go back into place. And I just remember looking up at the sky, and it was just perfectly blue with a couple of puffy white clouds, and I just laid there.
To me, it was the most severe knee injury I've ever seen. Both of his PCLs were torn, one of his ACL was partially torn, and both of his MCLs were partially, if not totally torn. And the result is that, of course, he cannot walk at all. Finally, there was a specialist that said he agreed to try surgery on him. It just dawned on me how hard this rehab process is going to be for him and his family. He's self-employed, so if he's not working, there's no income coming in for him.
When we started back with Lem after the surgery, we had to start from square one. And so we started with little things with rubber bands, and I'd have to pull on the rubber bands, but then we used that. I don't know what I would have done without those guys and Lem at physical therapy, because there was no way I could have done that by myself. By the time I left therapy, Lem had me sprinting in, which they told me I could maybe jog. Lem had me sprinting in the hall up there, and it felt really good to get to that end and do things that I was being told that may not happen. So it was pretty emotional. The last days there were pretty emotional.
Somehow, after a full year of rehab, Tim is back to his normal job. I'm just really glad for him and his wife, how they have conquered this together.
I had troubles with fibroids, and basically they had told us that we probably wouldn't be able to get pregnant. And then I decided to take it upon myself, and I did a lot of research about the organic way and things like that. And so when we got pregnant, of course, it was considered high risk. I was actually 8 months along. It was June 3rd, 1999. I woke up at 4:30 in the morning. I felt a warm sensation. Something wasn't right, and I'm sure that's what woke me up. And I started to get up, and I realized I had been laying in a pool of blood, and I was bleeding.
I rushed down to call the hospital, which we were supposed to go to the Madison Hospital.
And he said, "Deb, we can't make it. We can't make it to Madison." I was trying to wrap towels and blankets around myself because I was bleeding profusely. And I said, "Well, then we've got to go to the Richland Hospital." He called the emergency room, told them we were on our way. They were waiting for us. And it was just like they knew us, and whisked me right into the emergency room. I remember the sense of calmness almost about them, as I felt like I was just gonna explode. Dr. Cook came in at the time then, and he introduced himself to me, and he said, "We are not gonna lose this baby." And the way he said it, I just thought, everything's going to be okay. He says, "We're going to do an emergency C-section on you." And he said, "Everything's going to be okay." And that's the last I remember.
"15 minutes later, Brooklyn is in my arms, and I'm feeding her a bottle.
When I woke up, I was in the room already. They had gotten me back to the room. And Darrin was standing there with this tiny little baby, perfect. And he had a smile from here to here with her in his arms, and he said, "We had a baby girl." I wonder if I could have survived an hour trip. As much blood as I had already lost, I don't know if I would have made it to Madison. Without the Richland Hospital, I truly believe we would not have Brooklyn today.